All this is Dr. Mubin Sayed from Drbeen.com. Today is the day that I am going to test your knowledge for the COVID-19. So what I wanted to do today is that I've been receiving a lots of questions still about the pathology of COVID-19 or SARS-CoV-2, about the pathophysiology of it, the mechanisms of those. So I thought, just like we did a summary for the food, and then we did a summary for the treatment options, I wanted to pull together all of various pathologies and the comorbidities for the COVID-19 into one video, so that we can kind of look at the bigger picture together. So let's start with that. Thank you everyone for joining. Welcome. So the objective for today is, at the end of the discussion, you should have this idea that what are various categories of damage that occurs because of COVID-19 and why does that happen. So let's start. So here, if you look at it, and this was a very common question nowadays, that people were saying, we have various videos where we've talked about hypercoagulability or ACE2 and ACE1 or cytokine storms, but the whole bigger picture was not together. So that is what we're doing today. So the pathophysiology of the COVID-19, most of these things have already been discussed. Let's start in the bigger categories. So what are the big categories? Number one, the damage because of the SARS-CoV-2 is to the cell or tissue, and that destruction is direct destruction by the virus. And can you tell me, what does that mean? Viral destruction. So if I come in here, let's say we go here. Let's say this is a cell. In this cell, by binding to ACE2 enzyme, the coronavirus, the SARS-CoV-2, has entered the cell, correct? It is here. When it has entered the cell and now it is replicating there, it is dividing there, and we know the mechanism for that. Eventually, it is going to eject from the cell. Now, in the process of ejection, this virus can either destroy the cell or may spare the cell. So what happens is, while it is ejecting, if the membrane around the virus is in a state that membrane, so I call it membrane, this is really an envelope, but it is our membrane. When that membrane can easily, or the envelope around this can easily fuse with this membrane of our cell and then allow the virus to kind of eject out, then it is a good outcome for the cell because the cell has not been damaged. But in certain cases, in many cases, the virus actually just breaks the cell membrane on the way out and causes the damage, and cell dies. So there is the Carolyn says that apoptosis. Carolyn, this is not apoptosis. Apoptosis will happen when we have an intact cell and we ask it to die. That would be apoptosis. This is really just on the way out of the cell. If the virus could go out decently by opening a tiny door and get out, then the cell is okay. Still, it is an infected cell. Eventually, it's going to die, but it is okay for now. Or the virus can actually just burst out of the cell membrane and break the membrane on the way and cause the cell to become damaged. So that is one kind of damage that happens to our tissue because of the virus replication and then ejection from the cell. So that is a viral infection. Then the second kind of damage that happens to the cell is that this cell has been taken over by the virus. And the taken over part is still okay as long as if the cell had the capability to defend itself by the defense proteins that it can make, plus if it could release interferons, for example, beta interferons, then it can tell the other cells nearby to be careful. If those kind of things could happen, then the cell would also be sort of okay and the surrounding cells will be more okay. However, We know that the coronavirus sends its cargo, that means its message. So this is a coronavirus here. It would send a message in the DNA of our nucleus of our cell and tell it to not produce interferons and not defend itself. So the cell's defense mechanisms are stripped down, which causes the cell to become even more vulnerable. So first damage to because of the coronavirus is because of direct virus infection, causing the cell to either break and to not be able to defend itself, right? So that is one category of damage. Second category of damage is when the cell, when the ACE2 enzyme gets involved. And again, we have done this discussion a lot in the past. I'm just going to, in a summary, discuss it here. So what will happen is that, remember we talked about it, that we have liver makes angiotensinogen, kidneys, they make renin would act on angiotensinogen and make angiotensin 1. Angiotensin 1 will go to the lung tissue, and in the lungs blood vessels, angiotensin 1 is converted to angiotensin 2 by ACE1 enzyme. ACE1, it's not ACE2, ACE1 enzyme. So when the angiotensin 2 is produced, this is number one, vasoconstrictor. It causes the blood vessels to constrict, vasoconstrictor, plus it is pro-inflammatory. So I think you'll be excited today that we would look at the whole picture together in one shot. So angiotensin 2 is now pro-inflammatory. Now to counter this, some of the angiotensin 1 connects with ACE2 enzyme. This is the same ACE2 to which coronavirus binds. It connects with the ACE2 and becomes angiotensin 1 to 7 molecule. That's the name of the molecule, angiotensin 1 to 7. This molecule, angiotensin 1 to 7, is opposite to angiotensin 2, and that is, it is a vasodilator, plus it is anti-inflammatory. It is anti-inflammatory. So that means there is, in our healthy individuals, there is a balance between angiotensin 2 and angiotensin 1, or I shouldn't say 1, angiotensin 1 to 7. And there is a balance between vasoconstriction and vasodilatation. There is a balance between pro-inflammation and anti-inflammation, and we have a healthy outcome. Now what happens is, when the virus appears in our body and it starts connecting with the ACE2 enzymes, and that in that process, it brings the ACE2 enzyme inside the cell, because the virus is going inside the cell as well, that causes the amount of ACE2 present on the cells to reduce. So when that is reduced, what is now happening is that angiotensin 1 is still becoming converted to angiotensin 2, because that is the ACE1 enzyme, but angiotensin 1 is not getting converted to angiotensin 1 to 7. This pathway is broken. This pathway is broken because ACE2 is damaged or gone, and that means anti-inflammatory action is gone, pro-inflammatory action is still there. And now think about it, there is one enzyme or molecule that is anti-inflammatory, other one is pro-inflammatory. We took out the anti-inflammatory, so the pro-inflammatory is now going to be even more, because it is not opposed by anything, number one. And number two, because now the angiotensin 1 here, that was converting into these two kind of molecules, is not converting into two. It is all going to become angiotensin 2. So the amount of angiotensin 2 will actually increase, and angiotensin 2 is dangerous. So if I come back here, what will happen is that when the ACE2 enzyme is destroyed or internalized into the cell, angiotensin 1 to 7 is reduced, angiotensin 2 is increased, the result is inflammation. So now please realize that this is not an immune system dysregulation. This is an inflammatory system dysregulation caused by the virus. There will be inflammation because of immune system dysregulation as well. That is another category of damage. So now we are looking at a damage where the virus has caused an imbalance in inflammation and anti-inflammatory system. Now, we just talked about it. When we have more angiotensin 2, then we will have more inflammation. And why do we have more inflammation? Why is angiotensin 2 pro-inflammatory? Because angiotensin 2 helps the cells produce reactive oxygen species. Reactive oxygen species, we know, are pro-inflammatory. How? Number one, they cause the cell membrane damage. Number two, they cause macrophage recruitment. So they cause the immune system cells to come over. In that process, that what would happen is, because the angiotensin 2 is running around in the blood vessels, it will have a better chance to attack the blood vessel cells. So the vessel wall damage would occur first. This is that hypercoagulability state issue. And of course, now we have damage. So this is the second category of the damage. What was the first category? Where virus itself is infecting the cells and breaking them. Second category is where the ACE2 enzyme has become more, and the opposing enzyme ACE1 to 7 is not there in that much quantity, and ACE2 is now, why am I calling it? It's the second category is where angiotensin 2 is more, causing more inflammation and causing blood vessel wall damage. Good so far? Now, ACE2 enzyme is present in kidneys in very large amount, lungs, gastrointestinal system, heart, blood vessels, and brain. So all of those tissues which have ACE2 abundantly present in them become a target. So of course, the primary target is the lungs, but there are other tissues that are also a target. This is why the patients easily get gastrointestinal issues too. And we have done this discussion in the past. I'm just putting them all together in this one video, so it is one complete set in front of us, that coronavirus can survive in the gastric acids because coronavirus has a layer of glycoproteins around it which can resist the gastric acids. So this virus can actually cause gastritis and gastroenteritis. Okay, so kidney damage can occur, lung damage we already know, GIT damage, heart damage, blood vessel damage, brain damage, and we know this thing. So from kidney damage, renal failure. Renal failure can occur because of two reasons, or multiple three reasons. Number one, maybe viral damage. Number two, hypoxia. When the lungs are damaged and oxygen is low, that would cause damage to the kidneys, because kidneys are very highly performing tissues, just like heart is very high performing tissue. And the high performing tissues, when you give them less oxygen, they become damaged very fast. And third reason for the kidneys to become damaged is that when blood vessel walls are becoming damaged, and that causes the blood vessel walls to start dilating. And when the septic shock starts occurring and the vasodilatation occurs, and that would reduce the blood pressure and blood volume that is flowing to kidney, mostly the blood pressure, which would then cause the kidney to lose or get less blood flow, which would cause the kidney damage. Kidney needs very high volume of blood to pass through it. And now when the vasodilatation occurs and when the congestion occurs, when the blood vessel walls are damaged, the fluids ooze out of the blood vessel and accumulate in the tissues of the person, and the blood inside, or the fluids inside the blood vessel system, is reduced. So the kidneys reduce less volume. So three reasons for the kidneys to become damaged. GIT damage, similar thing. Ischemia can occur because of lung damage and less oxygen, but direct damage by the virus as well. Heart, similar thing, and we'll talk more about that in a bit. Vessels, very important, hypercoagulability. Angiotensin 2 and angiotensin 1 and 7 are directly present in the blood vessels. So their balance has to occur within the blood vessels. So when they are imbalanced within the vessels, it is the endothelium of the vessels, the cells of the vessels that get damaged the first. This is why hypercoagulable states occur. And then brain. So continuing on. Third category of damage is the immune system dysregulation, or some people call it macrophage activation syndrome. For example, Dr. Paul Marik in Math Plus protocol. Others call it cytokine storm. Others call it cytokine release syndrome. So there are many ways to mention it or to say it, but eventually it is the immune system that is dysregulated and has overwhelmingly been responding to the damage by the virus, and now the immune system itself is causing the damage. And we have looked at it a number of times, that how various cells, for example macrophages and dendritic cells, they start producing lots of interleukins, and there is lots of RANTES produced, and there are a lot of other chemokines produced, and lots of immune cells come over to the area of infection and start causing damage, and then they forget how to calm down, and that imbalanced immune system just keeps causing damage to the whole body. So systemic tissue damage would occur because of dysregulated immune system. Septic shock would occur because immune system dysregulation would cause inflammation and damage to the blood vessel wall, which in turn would cause vessel dilatation, which in turn would reduce the blood pressure, plus dilated and damaged blood vessels would cause the fluids to ooze out of them, which would cause reduced blood volume inside the blood vessel system, which would reduce the blood volume and blood flow to the tissues, and these tissues will be damaged. Then severe lung destruction, because the primary battleground with the virus is inside the lungs. And because when the immune system goes mad, the first place it goes mad is the lungs. The majority of the damage is inside the lungs. So that is the third category. Fourth category is the immune system dysregulation that continues even after the person has recovered, or probably the virus continues to persist even when the person's symptoms have recovered, and that results in long haulers. And this is or. It is possible in long haulers that the immune system dysregulation is continuing, plus some viruses persisting as well. I haven't yet seen a lot of studies to observe the pathology exactly in the long haulers, so I can only think aloud with you in medical terms or in medical concepts without telling you a precise mechanism for long haulers. I think there are multiple ways that long haulers can have persistent symptoms. For example, when the tissue has become damaged, then it might take long time to recover from that damage. So till that time, the person may have symptoms. So that has nothing to do with the immune system. That has nothing to do with the virus itself. Then it is possible the person has gone into some sort of a chronic state with the virus. Virus is staying in there in a lower quantity, but still there causing damage. Or, and this is all or. And so lastly, it is possible that immune system has gone dysregulated and has not yet recovered from that dysregulation and just continuing on for months now. So that is another category of damage that you see. Now, if we look at the same pathophysiology, we now know the mechanism, obstruction and the imbalance between ACE2 and ACE1, then macrophage activation syndrome or the cytokine storm, then dysregulated tissue or damaged tissue or the viral persistence causing the long haulers. So with this, so somebody said that no audio. Are you able to hear me? Am I just speaking to myself? Okay. Okay, perfect. Now let's look at the outcome for various tissues, and let's look at the comorbidities that we have talked about one by one in different videos. Look, respiratory damage, first of all. So of course, respiratory damage starts with mostly upper respiratory system. I'm talking about the typical symptoms. Upper respiratory system, that means dry cough, the congestion, the sore throat, and so on. A runny nose is less common. Then lower respiratory system uh, symptoms, which usually start as atypical pneumonia. And I have done this discussion before. Atypical pneumonia is where the person's, if you take the chest x-ray, it looks normal. If you look at the sputum of the person, there is no productive sputum, there is no uh, extra sputum coming in. And that is because the virus is sitting, it is usually viral, because the virus is causing damage in the interstitial part or the connective tissue part of the lung and not to the airways and the alveoli. So that would be dry cough with the atypical pneumonia. So there may be fever, but the person may still have a normal chest x-ray. Then this virus is crazy that it causes so much damage and so rapidly that then the alveoli or the airways. So if this is the alveolus here, this is another alveolus, and let's say here is a blood vessel, and between them is the connective tissue. This is the respiratory barrier. Normally, in the beginning, the virus sits outside in the connective tissue and is causing the damage, but eventually it is going to cause damage in all of this tissue here. When that would happen, then we will have the other symptoms which are called typical pneumonia symptom. So there will be congestion in this area, there will be debris here, there would be pus formation here, there will be congestion, that is the fluid oozing out of the damaged and dilated blood vessels, and this whole area would start getting filled up with fluids, and that some part of that fluid will be ejected in sputum as well. So now there is typical pneumonia symptoms, although because it is viral, the fever is still low grade. Then acute respiratory distress syndrome would occur. And that is when the lungs have become so congested. So lungs have become so congested that they start filling up with fluid. And the person is now essentially drowning in their own body fluids, in the fluids coming out of their own blood vessels. So that would be the acute start of the acute respiratory syndrome. And as the fluid continues to accumulate, the acute respiratory syndrome would continue to become severe and severe, which would make a person oxygen dependent and then ventilator dependent. So then hypoxia. Of course, hypoxia would occur because of the damage to the lungs. Organ failure. Why would I write organ failure inside the respiratory system category? Because once the lungs start getting damaged, and once they cannot provide enough oxygen to the rest of the body, then the body tissues that are not receiving oxygen, that are in hypoxic state, will start getting damaged. And the damage is multiple dimensional, but the basic idea is that when there is no oxygen or less oxygen available, number one, the integrity of the cell membranes of the cells is compromised. The cells start swelling up, they start becoming big bloated things, and because their machinery is failing, which needs energy from oxygen, and so as their machinery start failing and they start bloating up and they start becoming big cells which are puffed up, the holes in the cell membranes would start opening up as well, and the fluids would start going in or coming out of the cell, and eventually the cell would die. So that is one reason why cells die in less oxygen. The second reason is that cells are still going to continue to try to produce energy, but there is no oxygen. So they're going to try to use anaerobic processes, which would produce lactic acid. And so the environment around the cell would become acidic. Acidic environment causes the cell and tissue damage. So there will be lots of reason that hypoxia or less oxygen would cause organ failure. This is why I put the organ failure over here. What will be the first organs to fail? Of course, lung itself. Then the high performing organs, for example, kidney, for example, heart, and then others. Okay, so let's continue. What will happen to the heart? Cardiac tissue damage. There are two reasons for the cardiac tissue damage. One reason is that the heart muscle cells have ACE2 enzyme on them, which will be used by the coronavirus to enter those cells and cause damage to the heart. So the coronavirus itself will be directly toxic to the heart. Second problem is that heart is now has to compensate for body that is under hypoxic situation. Because lungs are not able to give enough oxygen, body is going to demand more oxygen, and the only way heart knows to provide more oxygen is to try to pump more blood. And when a heart that is pumping more blood under a hypoxic state, heart itself needs lots of oxygen to work, then the heart will start becoming damaged as well. Now, this is the reason that people who have heart issues as a comorbidities, they are at a higher risk of dying because of COVID-19 or becoming critical or severe because of COVID-19, because their heart cannot take so much of insult, plus it cannot provide for the rest of the body because the lungs are not working correctly and providing oxygen. Does this make sense? So hypoxic damage to the heart, viral damage to the heart, and then increased workload on the heart to try to provide more oxygen and blood flow to the rest of the body. Vascular tissue damage. And we covered this one in two videos, hypercoagulability part 1 and 2. So vascular tissue damage, I just touched upon that a little bit above here as well. Vessels have ACE2 enzymes in them, and they have ACE1 enzymes in them as well. So the coronavirus would of course bind with ACE2 and get into the vessel endothelium and cause damage there. That is one way for the damage. Second damage is that because angiotensin 1 to 7 is less, angiotensin 2 is more. When angiotensin 2 connects with the blood vessel smooth muscles, it causes them to contract. And then when it connects with the blood vessel endothelium, it causes reactive oxygen species to be produced. That causes endothelial damage, which is blood vessel damage. I visualize it as, imagine there is a, the raking, where you rake the leaves. So imagine somebody takes a tiny microscopic rake and goes over the whole body's blood vessel and just scratches them. That is what coronavirus would do to the blood vessels. And of course, that would cause blood vessel to become damaged. And when the blood vessel is damaged, so let's say this is the blood vessel wall, and this is damaged now, endothelium is damaged, what would happen is, remember we talked about it, that the damaged tissue or the underlying tissue in the blood vessel would become exposed. Collagen would become exposed, broken cells will become exposed. That would cause the van Willebrand factor to become activated, and local thrombi would start developing, which would then give emboli, which are the broken up pieces of thrombi that are going to go downstream somewhere and get stuck in the blood vessel and cause ischemia of that part of the tissue. So bleeding disorders would occur, clotting would occur, thrombus would occur, thromboembolism would occur. This is what would result in strokes in some people. This would what results in the COVID toes in children. This is what causes the triggering of the Kawasaki disease in heart, and so on. So that is the heart and blood vessels. Then I just covered it now, hypercoagulability. Vascular damage causes clotting factors to become activated, which causes the thrombus to form, which then causes emboli to form, which then causes the number 1 bleeding disorders and number 2 ischemic conditions that would cause strokes and COVID-19 toes and so on. Then cytokine storm. I take cytokine storm as a disease caused by the virus and then a disease that causes further damage. The cytokine storm itself was started by the virus. It is the virus that set the whole thing in motion. Then the immune system became dysregulated. Then that mad dysregulated immune system is now causing damage to the rest of the body. So cytokine storm occurs, macrophage activation syndrome occurs, and we know what happens. We've done this discussion many times. So there's a question, what is the difference between COVID-19 and COVID-1? There is no COVID-1. If you saw somewhere over here, I must have misspelled it. COVID-19 is just coronavirus disease of 2019. That is what COVID-19 is. There is no COVID-1. Okay, so then Diabetes as a comorbidities. Why are the folks with diabetes more at risk? Multiple reasons. I'll give some high level reasons. Again, I've done a complete video. I think I am covering about 50 videos over here. Diabetes and comorbidities. Diabetes is a comorbidity. What happens is, in the diabetes, glucose is present in the body, in the blood vessels and in the tissues, but it cannot enter the cells and be used to make energy. That means the energy status of the cells everywhere in the body is less, including the immune system. So diabetic patients, especially those who have less regulated diabetes, will have a weak immune system, and they will not be able to mount a defense against the virus and become a victim easily. That's one. Secondly, diabetes is usually present in folks who have other comorbidities, for example, obesity. And so they have other dysregulations as well. Thirdly, diabetes causes severe vascular damage. This is why diabetics have, again, I'll keep qualifying, uncontrolled diabetes especially. These folks have heart attacks, and they have strokes, and they have diabetic foot and so on. That is because their blood vessels have gotten glucose attached to their cells like mud on them, and now blood vessel is become atherosclerotic. It has become damaged and it cannot function correctly, and it has become narrowed. That narrowed blood vessel would in turn cause damage to the tissues, for example, heart or brain or foot and so on. It also causes damage to the nerves, because the blood supply of the nerve is not intact, and the nerves are going to damage as well, to be damaged. So now put coronavirus on top of this, a diabetic person whose blood vessels are already narrowed, you start damaging those blood vessels and you have a worst outcome. So diabetes itself, low energy levels in general, reduced immune response because immune cells are not fully functional because of low energy, and then reduced blood flow to various tissues, which in presence of COVID will become even worse. Then obesity as a comorbidity. So a person who is obese, they have a few things that are going wrong, especially in case of COVID-19. Number one, obesity causes diabetes. Diabetes, most of the time, type 2 diabetes, is because of insulin resistance, and insulin resistance is because of obesity, which causes the free fatty acids to be produced. And free fatty acids are like they are like things that disrupt the insulin's function inside a cell. So insulin comes outside the cell and knocks on the doorbell or presses the doorbell, and that wiring inside the cell that would tell someone to do something, that wiring inside the cell is disrupted by free fatty acids. So insulin can stand on the door and press the bell as much as it wants. Nobody's going to open the door for glucose to go in. So that is one of the problem with obesity. Second problem with the obesity is, and again, we have done a separate lecture about that, is that we have adiponectin and liponectin dysregulation in obesity. And these are the things that usually prevent inflammation. And so when adiponectin and liponectin are dysregulated, then inflammation is easier to be produced. So that is another issue. Then children as a special case, and we have done this discussion many times. I'm going to just say it once more. Children have, if you start from their nasal and pharyngeal area, they have less ACE2 receptors there. So usually it is, and I'm talking about the children lesser than 10 years of age. So it is easier for them to evade the virus because the virus may not find enough binding spots. Then children have better NK cell count. Their NK natural killer cells are more than adults, and NK cells can easily handle, or at least in children, they can handle the virus much easily. And so children escape a severe outcome. Most of the children, they still get into severe state and they still have deaths in them. Then children have a better trained immunity. Trained immunity is the concept used for the innate arm of the immune system, which is better trained or has memory. So the other coronaviruses may have trained the innate arm, which causes the children to respond well. Then children may have better cross reactivity. There are frequent respiratory infections in children, which allow their respiratory system, immune system, to become a little better trained to handle other respiratory infections. So children usually are in a better situation. And then one last thing over here, not a very important point, and that is chemoprophylaxis. The objective of the prophylaxis is not to say that when the virus arrives, somehow the virus cannot arrive. The objective is to make our immune system strong enough that when the virus does arrive, we can take care of it easily. And so for that, we have talked about it, vitamins, especially vitamin D, vitamin C, then quercetin, zinc, hydroxychloroquine is a very good prophylactic drug. I would make air quotes over here because there are no studies that can say that, but anyways, it is a good drug. Ivermectin can be taken prophylactically as well. Difference between these two is the hydroxy has a longer half-life and the ivermectin has a shorter half-life. So if the ivermectin is going to be prophylactically used, it is probably going to be needed more frequently. And with this, I would say over here that this is not a prescription. So this is not for any single person to take these and then hope that the virus would not, they would not fall sick. This is not a treatment for anyone. This is just the observations that we have. So this is the discussion for today. What I did was I took the 100 or 50, 60 videos and I combined them into this one video. Tell me, do you have any questions? So this is a correct comment over here. 1x2 says if you are obese, it doesn't always mean you're diabetic. Absolutely. The obesity plus diabetes is a longer process. Plus, there are some genetic implications as well. But yes, you're correct that it doesn't always mean that. But majority of the obese folks would have diabetes. So there is a question from Arun saying chemoprophylaxis. So we're talking about prophylaxis. Should it include oxygen supplement? I don't think so. We are taking oxygen all the time. So I'm not talking about the treatment of it, but it is just a prophylaxis, prevention, or trying to prevent. And so that doesn't need oxygen. Mark Rice says, does stem cell therapy treatment seem to be a likely treatment for persistent COVID long haulers? I think so. So Mark, if it is tissue damage, then we have to do something about the tissue. If it is dysregulated immune system, then either those immune system suppressants or steroid type drugs. If it is virus still sitting in there, then that is a bigger issue because there are some viruses that become part of the body and people become carriers. So I haven't yet seen the carrier state, but this is possible. So the answer for the stem cell is it really depends on the type of damage. Abdu says that can statins be taken as prophylaxis? So statins do not have much effect on the virus itself. They are good and anti-inflammatory when the virus is there, but they would not stall the virus like hydroxy or ivermectin potentially can do. So, for the long haulers, again, depending upon the tissue damage, if the tissue is damaged, then they have to wait for the tissue to recover. In some cases, the tissue does not recover. For example, lung fibrosis does not recover, and they now have to live with that situation for forever, unfortunately. But one possibility is that they give time for a few months for the tissue that has become damaged to recover. In that case, just the same supplements that we've been talking about, the vitamins, especially for the recovering tissue, vitamin B12s or the B vitamins are very important because they provide the ingredients for the recreation of the cells. Folic acid is very important. Vitamin D, vitamin C are very important. So that is one kind of supplements, and I would continue to say that the quercetin and zinc and those things that are necessary. So multivitamin ITJ for long haulers, but it really depends if it is the immune system dysregulation, then just the multivitamins are not going to be enough. Okay. So this is a very good question, that what kind of, Cindy says, what kind of damage in the long haulers? So it really depends that what was the intensity of the long hauler. For example, what was the last stage from which they recovered? Were they on a ventilator or were they in an ICU? So then there may be tissue damage that is causing the long haul. Or if they recovered in mild to moderate stage and they never were ventilated and the tissue damage was not that extensive, then maybe there is immune dysregulation. So for that, immune system tests may be needed. And then it may be that the virus is still present, and maybe PCR test or the antibody test in addition to that are needed. So there's a question that why does or how does COVID-19 cause lymphopenia? Because it, in fact, lymphocytes are removed in two ways. Number one, the infection of the lymphocyte, destroying it. Number two, lymphocytes taking part in the infection control and in the inflammation, and in that process dying. So that is lymphopenia. So I'll talk separately about the long hauler pathology. I have to read up and I have to research that what are the basic pathologies in the long haulers so that I can talk about it. All right, guys. So this is what we have for today. Do me a favor, please like, subscribe, and share. And I would see you tomorrow. If you'd like to have some specific topics done, please tell me about those as well. So see you tomorrow.